Findings report shows WHO achieved global health successes despite COVID-19 pandemic. The Performance Report 2020-2021 is a good example of whose successes in global health despite the COVID-19 pandemic. Released ahead of the World Health Assembly, to be held next week, the report details achievements such as the delivery of more than 1.4 billion doses of vaccine through the COVAX Facility, the recommendation the widespread use of the world's first malaria vaccine in WHO's response to some 87 health emergencies, including the COVID-19 pandemic. During 2020-2021, WHO led the largest ever global response to a health crisis, working with 1,600 technical and operational partners, and helped boost the most important immunization campaign, the fastest and most complex in history. The organization has spent $1.7 billion to procure essential supplies for the COVID-19 response. While responding to the most serious global health crisis in a century, WHO continued to support its member states to address many other health threats despite tight budgets and disrupted services, said Dr Tedros Adhanom Ghebreyesus, Director General of WHO. End quote. As the world continues to grapple with and recover from the pandemic, in the years to come, WHO's priority is to invest even more resources to carry out activities in countries where it matters the most, end quote. He continued, adding, end quote, "It is essential that WHO has sustainable, predictable and flexible funding to fulfill its mission of promoting health, preserve global security and serve vulnerable populations." As of January 2022, the ACT Accelerator has delivered over 1 billion doses of COVID-19 vaccine. Among the critical health supplies deployed globally were personal protective equipment worth nearly $500 million, oxygen concentrators for $187 million, treatments for $4.8 million and diagnostic tests for $110 million. However, much remains to be done for 70% of the world's population to be vaccinated by July 2022, in line with the target set by the WHO. The effectiveness of the WHO outside the pandemic. The results report shows that the WHO has achieved remarkable successes outside of the pandemic response. Binding policies prohibiting the use of trans fatty acids, dangerous dietary compounds that cause cardiovascular disease, are in place in 58 countries, home to 3.2 billion people. Among these countries, 40 have good practices in this area, including Brazil, Peru, the United Kingdom, Singapore and Turkey. WHO's Replace initiative aims to eliminate trans fatty acids everywhere in the world by the end of 2023. Thanks to the implementation of the measures set out in the WHO Framework Convention on Tobacco Control, tobacco use is reduced in 150 countries, saving lives and preserving livelihoods. Through efforts to scale up life-saving interventions based on WHO guidelines, 15 countries have succeeded in eliminating mother-to-child transmission of HIV and/or syphilis. And, following WHO recommendation, the world's first malaria vaccine, RTS-S, was administered to more than 1 million children. Its use, along with other malaria control interventions, is expected to save 40,000 to 80,000 lives per year. A voice for health equity.